ndauya pano ndakamirira minister. Mungazoshama kuti chiri kuitika. Ndiri kuverenga on his behalf. Fellow Zimbabweans, it is an honor and privilege to address you as we officially launch the rollout of the oral cholera vaccination OCV campaign by the government of Zimbabwe through the Ministry of Health and Child Care, which begins today, the 29th of January 2024, as planned and is scheduled to continue in phases until all severely affected districts and wards in the country are covered. Cholera has long plagued our nation, caused untold suffering and claimed the lives of our loved ones since the onset of the outbreak in 2023. In recent weeks, we have witnessed the surge in the number of cholera cases, attributable in part to the onset of the rains and attended flooding and the increased population movements during the festive season. The stark reminder underscores the urgency of our actions and the importance of this vaccination campaign in complementing the existing public health and social measures that government has put in place to control the pandemic. Cholera vaccines are a known and effective public health intervention for cholera control that is coming to complement and not replace existing measures and investments that government has already implemented from the onset of the cholera epidemic. The vaccine campaign represents critical step forward in intensifying our collective efforts to eliminate cholera scourge in our beautiful nation. To kickstart the vaccination campaign, the country has so far received 892,286 doses out of the 2,303,248 doses that have been allocated to the country by the International Coordination Group, ICG, for cholera control. The vaccines have already been pre-positioned in all provinces and cities and severely affected districts of the country, including here in Harare. The next batch is expected in the country by the 5th of February 2024. The staggered delivery of the vaccines in the country is a result of the current global shortage of OCV occasioned by high demand from several affected countries in this region that are rolling out similar vaccination campaigns. As such, the Ministry of Health and Child Care will continue to be guided by disease burden statistics to determine priority areas for vaccination using a ward-based approach. In all prioritized wards, everyone above 1 year of age is eligible and will be targeted for vaccination. From today onwards, vaccinators will be deployed in all health facilities, schools, and other community vaccination points to vaccinate all eligible people in severely affected areas. The house-to-house and cluster-to-cluster method will be used in the spirit of leaving no one behind in the affected areas. The ministry will also continue to closely monitor the evolution of the pandemic to guide future prioritization for vaccination in the wake of the global shortage of cholera vaccines that I alluded to earlier on. The oral cholera vaccine, OCV, that we are rolling out today is taken by mouth and is a safe and effective tool that can significantly reduce the risk of contracting the cholera. I must be quick to say it is the same vaccine that we used in previous cholera outbreak prevention and the response campaigns conducted in the country between 2018 and 2020 in the city, in Chimanimani, Chipinge, and the Chegutu districts. The safe use of this vaccine in these previous campaigns in which millions of people were vaccinated and protected without incident should allay any safety fears or concerns that our people might have on this vaccine. Vari kutaura pano kuti vaccine yakatomboshandiswa muno munyika kune nzvimbo dzakasiyana siyana, Chimanimani, Chipinge, Chegutu nemuno muHarare patakamboita cholera muna 2018 nemuna 2020 ikashanda zvikuru, hapana akarwara nayo, hapana nechi, zvinhu zvakatomboshandiswa, hamusazeze, hapana chekutyaba kwete nekuti inobatsira, inoshanda. It is only by working together that we can ensure that this life-saving vaccine reaches every corner of our country and protects our communities from the devastating impact of cholera in the short term, while the longer-term infrastructure investments in water, sanitation and hygiene wash are taking shape in line with the government's vision. Vari kutaura kuti nyaya yemvura yatiri kuchema nenyaya yehygiene yeutsanana izvi muri kuona basa riri kuitwa nehurumende zvichafambira mberi, uye zvakare ndinoda kuti nditende, ndiri kuona meya tinawo pano, tiri kushanda pamwe chete zvikuru chaizvo kuti zvinhu izvo zvibudirire tiri pamwe chete zvienderere mberi. I want at this point to applaud the bold stance taken by the government so far in intensifying garbage collection, provision of clean water supply sources like boreholes and waterworks upgrades, and the recent launch of the collaborative cleanup campaigns like Operation Chenesa Harare, and similar initiatives including the disbursement of funds for cholera control operational activities. Sustained investments in these areas through the whole of government approach and public-private partnerships (PPP) will provide synergy to the public health and social measures necessary to control the current and future cholera outbreaks. The success of this campaign hinges on the active participation of every Zimbabwean. I urge all eligible individuals in the targeted districts and wards, from children to adults, to get vaccinated. It is a simple act that can save your life and protect your loved ones and your community. In the same spirit, we request all community leaders and school authorities from respective targeted areas in collaboration with our health teams to ensure that all eligible people are vaccinated for us to achieve herd immunity and control cholera. I call upon all of us, even after vaccination, to continue to observe good hygiene promotion practices like washing hands frequently with soap and water, using safe drinking water, and practicing proper sanitation, as these remain the cornerstone of preventing the further spread of cholera. OCV only protects you against cholera and will not protect you from other forms of diarrhea. Hence, our insistence on good hygiene and proper sanitation. Zviri kunzi panapa hongu vaccine kana mapuwa tese tapuwa, tisakanganwe kuti hygiene, kugeza maoko, zvakakosha zvikuru. Nyaya yeutsanana, kudziviridza zvimwe zvirwerewo zvingazongotibata zvemanyoka nezvimwe zvakasiyana siyana. Ipapo ngatirambe tichiziva izvozvo. On behalf of the Ministry of Health and Child Care, I want to express sincere gratitude to government partners, including the World Health Organization, UNICEF, Gavi, the Vaccine Alliance, the International Coordination Group of Cholera Control, ICG, other national and international organizations for their invaluable support in making the rollout of this cholera vaccination campaign possible. The technical support resources and commitment have been instrumental in our preparations for this rollout. May I also acknowledge the whole cholera incident management system and national sub-national health teams that worked hard in preparing for the rollout of this vaccination drive. I appreciate the dedication to serve and the ministry endeavors to continue to support your work as necessary. I am confident that with unity, commitment and decisive action, we can defeat cholera and ensure a healthier future for all Zimbabweans. Together, we can win the war against cholera. With these words, I declare the cholera vaccination rollout campaign in Zimbabwe officially launched. Dr. Hove, if I may then ask you to officially launch the campaign. Ndoda kukutenda zvikuru ana mai mukarati vamwe vese vandaona mina nebasa rawaya pano. I thank you so much. Maita Jane. Dr. Hove.
For me, today is a very, very happy day for children. It is a happy day for children, not just because the vaccine will help prevent cholera in children, but the vaccine will have major impact in women and mothers, because we have a significant proportion of cases affecting women. And you know that when women are safe, healthy, and strong, the child is going to be healthy as well. In that joy, allow me to acknowledge the leadership of the Ministry of Health and Child Care on the overall cholera response, but specifically on the preparation leading to today, both in terms of the planning for the oral cholera vaccination campaign, the receipts and negotiation for the campaign, but also the launch and the deployment of the vaccines that are started. And in so doing, to acknowledge the tireless effort of my colleagues in UNICEF, in WHO, and also in Gavi, the Vaccine Alliance, for making these vaccines available. It has been said already by the Honorable Minister of State that we do have an outbreak of cholera, and we do have an outbreak in Kwazana here in Harare. And in the whole, I'm sure the Honorable Minister's speech will attest to the current status of the outbreak in the country. But for us as UNICEF, this outbreak has come at a very difficult time. It came when we as a country, we are recovering from the impact of the COVID-19 impact on the country and on the health system. It came when the country is making effort at improving, which it is already achieving, the coverage of routine vaccination. It came when the country is deploying a lot of resources to build the health system. And when you have outbreaks like cholera, it is a distraction from that. And I'm saying this because this tells us why all of us needs to come together to aggressively take this vaccine, aggressively do all the prevention activities, including hand washing, water treatment, water safe management, safe sanitation practices, so that we can get this distraction off the track and we can move ahead with the major plans of the government. This vaccine and this vaccination that we're starting today will target 2.3 million people, including children. And it will target individuals from the age of 1 year and above. So you see that a high proportion of that will be children as well as women. In 160 wards in the 26 high burdened districts across the country. We are pleased to see that there is a deliberate focus in using science to target where the vaccination campaign will be. We are also very happy to see that a lot of community system and community network will be deployed towards ensuring quality vaccination, but also high level of vaccine coverage. Honorable ministers here present, ladies and gentlemen, UNICEF and our partners will continue to stand side by side with the government of Zimbabwe and partners in several areas of the response, which includes coordination, risk communication and community engagement, on the procurement and logistics of supplies to make this vaccination work, but also to respond to the bigger issue of prevention for cholera, on infection prevention and control, support to the health systems in managing cases so we can continually have reduction in number of deaths, and also investment in water, sanitation, and hygiene. Allow me, ladies and gentlemen, to sincerely thank all the health workers in Zimbabwe. In the most difficult terrain, at the most difficult times, including during the Christmas and New Year break, the health workers in Zimbabwe, the health promoters in the villages, the community health workers, you were out there saving lives. And what you have done, really, I think they deserve a clap. What you have done is what has kept us safe till today. We are not happy with the number. We are not happy with deaths, but your effort has kept it at that number. And now is the time to reverse that trend and start going backward towards zero. As I conclude, ladies and gentlemen, allow me to also use this opportunity to thank our different partners, both the funding partners and the implementing partners who have rallied around the national response led by the government of Zimbabwe. In this context, I want to thank the government of the UK, the EU, Ireland, the government of Japan, ECHO, the UN Consolidated Emergency Relief Fund, Gavi, and CDC for your support. But on the ground, the people you see who really serve the community with the community actors are MSF, Oxfam, Christian Care, WHH, AWET, and many more partners, including a lot of community health workers and a lot of health promoters who stand every day with communities towards ensuring that we are all safe and we can come out of this very, very protracted cholera outbreak. Again, if we can give our hands to these great workers and the health workers as we look forward to this vaccination. I will conclude by saying in 2018-2019, Zimbabwe took the cholera vaccine and stopped the transmission. And that already tells us that we know what to do, we are ready to do it, and we will do it. And in so doing, UNICEF and WHO will stand with you towards ensuring quality delivery. I thank you very much for your attention. Attendance here.
Saka tiri kutenda Ministry of Health necooperation yainotipa panyaya dzezvirwere cholera, COVID nemari yavanotipa. We are very appreciative of that, and we hope that the complementarity can continue. We are also, of course, as a city of Harare, we bear the brunt of the health system in Zimbabwe and Harare. And we keep asking for more resources to be able to respond. We also want to thank the provincial setup, the provincial government for cooperating with us. We work very well with Senator Charles Tawengwa here. I'm happy to hear that you were 3 times the mayor. I'm only on my 2nd time. So I still have a few more times to do it. But we are happy that you are here. You are well versed in the city issues. And munoziva pamakaresha. Munongoti wispira tongopagadzirisa muchinyararire and so forth. Nepamanogona tobva tapadzidza. We also want to thank the WHO and UNICEF for the assistance that they've given to this program. The vaccines, we are made to understand they're in short supply, and we don't take it for granted that they are now here in Zimbabwe and in Harare in particular. This will go a long way to deal with the issues. We know we've had a lot of cooperation with UNICEF and your partners in our SWASH sector, and we hope that we can continue. We have issues in chemicals, water chemicals, to treat the water. We have issues in relation to sewer. We have issues in relation to solid waste, and we hope we could sit down and be able to deal with cholera from its root causes. On our part as the city, we are intensifying our efforts together with government to work on the chemicals, to work on the solid waste, issues around tractors, issues around, I think we've received 30 tractors from the Ministry of Agriculture, and we should be receiving 20 more tractors. We are going to deploy them at every ward so that they can carry and augment the refuse compactors. We are going back to basics so that mararadini abviswe. Tinoda kutendawo cooperation yatiri kuita nelocal government panyaya yekubvisa madump site. Kana muri kuona madump site ari kubviswa mumamisha, ticharamba tichiita program iyoyo tibvise madumps. We remove those dumps so that at least they won't be litter in the suburbs. We also want to thank the Director of Health in the ministry. We want to thank the workers, the first responders, nokushanda kwamakaita pama holidays, nepa New Year, nekushanda kwamuri kuramba muchiita. If you are not working, this system does not work. So we are very appreciative. We also want to thank our Department of Health in the council. We are going to improve the working environment. I'm seeing that the clinics need to be refurbished. Our health infrastructure needs to be improved. We are going to look at it so that we are able to respond better to the problems that people are facing. We are also thankful of the members of council, the councillors on both sides of the divide. Cholera ishari, cholera ivunzi party, cholera ivunzi kuti unobva kupi kana yabata yadini yabata. So we want to thank the councillors for working together, both ZANU-PF and Triple C, in harmony to deal with the issues that are affecting the people. We also want to thank members of the media. You bring the awareness for this vaccine to work. It will be the members of the media who will popularize and encourage people to take the vaccine. So we want to thank the members of the media for being here. And lastly, we want to thank Mese Mauya, Vanamai, Vanababa, Mati Chingamidza Pano, Nemufaro, Tinotenda, and we hope that you support this vaccination program. I hope Master of Protocols have been able to thank everyone. Oh, I want to thank the immunization pillar. You helped organize this event together with this beautiful tents and setup where we are shielded from the sun and other things. We don't take your work for granted. I had not been told about you. Hopefully you also prepared food for the people who are here. But all the same, if you only prepared them to eat vaccines, we shall eat vaccines. We are very happy and delighted with the efforts that you have given. So the city of Harare will commit to do anything and everything to remove cholera from its midst. And we will not leave a stone unturned in our efforts to make sure that we do not have a repeat of this disease, which is basically a medieval disease, which should not be occurring in this day and age. But here we are. The whole of Africa and the region seems to be struggling a little bit, and the world over. But we hope that with these efforts, we should be able to deal with the issue and get on top of the situation. Thank you.